Antimicrobial resistance, or AMR, is becoming one of the most pressing challenges in global health today. This phenomenon occurs when bacteria, viruses, fungi, and parasites evolve to resist the effects of medications, making standard treatments ineffective and infections harder to control. As we begin this journey, it's important to understand why AMR matters and how it impacts our daily lives. The rise of resistant microbes threatens to undermine decades of medical progress, putting both individuals and communities at risk. Let's explore what AMR is, why it's spreading, and what it means for the future of healthcare. AMR develops when microorganisms adapt to survive exposure to antimicrobial drugs. Overuse and misuse of antibiotics in humans and animals are major contributors. For example, taking antibiotics for viral infections or not completing a prescribed course gives bacteria a chance to develop resistance. In agriculture, antibiotics are often used to promote growth in livestock, further accelerating resistance. These practices create an environment where resistant strains thrive, making it harder to treat common infections. Understanding these causes is crucial for developing strategies to combat AMR. AMR is not confined to one region or country, it's a worldwide issue. Resistant microbes can travel across borders through people, animals, and food. International travel and trade make it easier for resistant strains to spread rapidly. In some countries, lack of regulation and poor infection control contribute to the problem. The global nature of AMR means that coordinated international action is needed to address it. As we move forward, we'll see how AMR affects health systems everywhere, regardless of geography. AMR has a profound impact on healthcare systems. When infections become resistant to treatment, hospitals face longer stays, higher costs, and increased mortality rates. Procedures like surgeries, cancer treatments, and organ transplants rely on effective antibiotics to prevent infections. Without them, these procedures become riskier. Healthcare workers must use stronger, more expensive drugs which may have more side effects. AMR strains resources and challenges the ability to provide safe, effective care. AMR threatens public health by making common infections harder to treat. Diseases like pneumonia, tuberculosis, and urinary tract infections are becoming more difficult to cure. Outbreaks of resistant infections can spread quickly in communities, especially where healthcare access is limited. Vulnerable populations such as the elderly and immunocompromised are at greater risk. The threat extends beyond hospitals, affecting everyday life and community health. AMR carries significant economic consequences. Healthcare costs rise as more expensive drugs and longer hospital stays become necessary. Productivity declines when people miss work due to prolonged illness. Countries may face increased spending on public health campaigns and infection control. The economic burden is felt at both the individual and national levels, making AMR not just a medical issue, but a financial one as well. AMR affects everyday life in subtle but important ways. Simple infections that once required a short course of antibiotics may now need stronger drugs or longer treatment. Families may worry about their loved ones contracting resistant infections. The risk of untreatable illnesses changes how people approach health and hygiene. Awareness of AMR encourages more careful use of medications and greater attention to infection prevention. Children are particularly vulnerable to the effects of AMR. Their developing immune systems make them more susceptible to infections. Resistant bacteria can complicate treatment for common childhood illnesses, leading to longer recovery times and more severe outcomes. Pediatric care providers must be vigilant in prescribing antibiotics and monitoring for resistance. Protecting children from AMR is a priority for families and healthcare systems. Elderly face heightened risks from AMR. Age-related health conditions and weakened immune systems make them more prone to infections. Resistant microbes can turn routine illnesses into life-threatening situations. Long-term care facilities must implement strict infection control measures to protect residents. AMR challenges the ability to provide safe, effective care for older adults, emphasizing the need for prevention and vigilance. Surgical procedures depend on antibiotics to prevent infections. AMR increases the risk of complications during and after surgery. Surgeons must carefully select antibiotics and monitor for resistance. Postoperative infections caused by resistant bacteria can lead to longer hospital stays and additional interventions. AMR makes surgery riskier, requiring new strategies for infection prevention and control. Cancer patients often require antibiotics to prevent infections during chemotherapy and other treatments. AMR complicates this process, making it harder to protect vulnerable patients. Resistant infections can delay or interrupt cancer therapy, affecting outcomes. Oncologists must adapt their approaches to manage the risks posed by AMR. Protecting cancer patients from resistant microbes is a critical aspect of modern oncology. Organ transplant recipients are highly susceptible to infections due to immunosuppressive drugs. AMR increases the risk of post-transplant complications, making it harder to ensure successful outcomes. Transplant teams must monitor for resistant infections and adjust treatment plans accordingly. The threat of AMR underscores the importance of infection prevention in transplant medicine. Agricultural practices contribute to AMR through the use of antibiotics in livestock and crops. Resistant bacteria can spread from farms to humans via food, water, and the environment. Efforts to reduce antibiotic use in agriculture are essential for controlling AMR. Sustainable farming practices and regulations help limit the spread of resistance, protecting both human and animal health. AMR affects the environment as resistant microbes enter soil and water systems. Waste from hospitals, farms, and households can carry antibiotics and resistant bacteria into the ecosystem. Environmental contamination contributes to the spread of resistance, making it a multifaceted problem. Addressing AMR requires attention to environmental health and pollution control. International travel increases the risk of spreading resistant microbes. Travelers may encounter different strains of bacteria and bring them home, contributing to local outbreaks. Airports and hotels must implement hygiene measures to reduce transmission. Awareness of AMR is important for travelers, who should follow health guidelines and seek medical advice when needed. Preventing AMR requires coordinated efforts across healthcare, agriculture, and communities. Strategies include responsible antibiotic use, infection control, and public education. Healthcare providers must prescribe antibiotics only when necessary and monitor for resistance. Farmers should adopt sustainable practices and limit antibiotic use. Public awareness campaigns encourage safe medication practices and hygiene. Vaccines play a vital role in preventing infections and reducing the need for antibiotics. By protecting against diseases, vaccines help limit the spread of resistant microbes. Immunization programs are an important part of AMR prevention strategies. Increasing vaccine coverage can reduce the burden of infectious diseases and slow the development of resistance. Research and innovation are essential for combating AMR. Scientists are developing new antibiotics, diagnostic tools, and treatment strategies. Investment in research helps identify resistant strains and track their spread. Innovative approaches such as rapid testing and alternative therapies offer hope for managing AMR. Collaboration between governments, industry, and academia is key to progress. Effective policies and regulations are needed to control AMR. Governments must enforce guidelines for antibiotic use in healthcare and agriculture. International cooperation ensures consistent standards and monitoring. Regulatory frameworks help limit misuse and encourage responsible practices. Policymakers play a crucial role in shaping the response to AMR. Community engagement is vital for preventing AMR. Local organizations, schools, and families can promote safe medication practices and hygiene. Grassroots efforts raise awareness and encourage responsible behavior. Communities must work together to support infection prevention and limit the spread of resistance. Empowering individuals creates a stronger defense against AMR. Healthcare workers are on the front lines of the fight against AMR. They must follow infection control protocols, prescribe antibiotics responsibly, and educate patients. Training and support help healthcare workers stay informed about resistance trends. Their vigilance and expertise are essential for protecting patients and preventing the spread of resistant microbes. Patients play a key role in preventing AMR. They should follow prescriptions carefully, avoid demanding antibiotics unnecessarily, and practice good hygiene. Understanding the risks of resistance helps patients make informed decisions. Patient responsibility supports healthcare efforts and reduces the spread of resistant infections. Surveillance systems track the spread of AMR and identify emerging threats. Data collection and analysis help guide public health responses. Monitoring resistance patterns enables early intervention and targeted strategies. Surveillance is a cornerstone of AMR control, supporting research and policy development. Global cooperation is essential for addressing AMR. Countries must share information, resources, and best practices. International organizations coordinate efforts and provide guidance. Collaboration strengthens the response to AMR and ensures consistent progress. Working together is the only way to overcome this global challenge. The future of AMR depends on our actions today. Continued research, innovation, and prevention strategies offer hope for controlling resistance. Advances in medicine and technology may provide new solutions. Public awareness and policy support are crucial for sustained progress. The outlook is challenging, but with coordinated efforts, we can protect health and save lives. Individuals can take simple actions to help prevent AMR. Practicing good hygiene, following medical advice, and avoiding unnecessary antibiotics are key steps. Supporting vaccination programs and staying informed about resistance trends also make a difference. Personal responsibility contributes to community health and strengthens the fight against AMR. Some countries and communities have made progress in controlling AMR. Success stories include reduced antibiotic use, improved infection control, and public education campaigns. These examples show that coordinated action can make a difference. Learning from successful strategies helps guide future efforts and inspires hope. Despite progress, significant challenges remain in the fight against AMR. Emerging resistant strains, limited resources, and gaps in public awareness hinder efforts. Addressing these challenges requires ongoing commitment and adaptation. The road ahead is difficult, but determination and collaboration can overcome obstacles. AMR affects health, economy, and society in profound ways. It challenges medical progress, increases costs, and threatens vulnerable populations. Understanding the impact of AMR is the first step toward effective prevention and control. By working together, we can limit resistance and protect future generations. Fight against AMR requires everyone's participation. Healthcare providers, patients, policymakers, and communities must join forces to promote responsible antibiotic use and infection prevention. By staying informed and taking action, we can slow the spread of resistance. Together, we can safeguard health and ensure a brighter future for all.